The question is that this House do now adjourn, and I come to Dave Robertson on government support for the Clive Treacey Safety Checklist. Dave Robertson.
Thank you, Madam Deputy Speaker. It is an honour and a privilege to be able to lead this debate tonight on government support for the Clive Treacey Safety Checklist. I secured this debate in Clive's name, and I want to start by telling the House a little bit about Clive. I never had the pleasure of meeting Clive, so I'm drawing here on the words of his family who knew him best. Clive's sister and his father Michael are in the gallery this evening, and I'm really glad that they were able to see proceedings. They've been tireless advocates for Clive, making sure that his voice is heard, and I hope that I can do their efforts justice tonight. Clive was born in Lichfield in my constituency in 1969. He was soon diagnosed with a learning difficulty and between the ages of 8 and 10 with epilepsy. Now, I will be covering both of those factors today. Sadly, they are important to understand Clive's death and the failures of care throughout his life, but they do not define what Clive's life was. And I really do want to make sure that the House can hear who Clive was. He was a talented artist and gardener, gifted with a brush and able to make plants spring seemingly from nothing. He loved music, especially Elvis Presley, and was often singing and dancing. His family remember him as the life of the party. He wanted to work in a garden centre, helping to raise plants. He wanted to have his own home, close to his family, to own a cat, to learn to drive, to go on holiday to Blackpool and to Somerset. And he was really devoted to his family as they were to him. He was known as the family calendar, never forgetting a card for a birthday, Christmas, Easter, or any other reason. His sister Elaine says her brother was engaging, humorous, gentle and loving. His parents, Pauline and Michael, have said that his heart knew no bounds and described their son's magical qualities throughout his life. In all of the accounts of Clive that I've heard, his love and optimism really do shine through. Clive passed away in 2017 at just 47 years of age after a seizure caused by his epilepsy brought on cardiac arrest. This is what's known as SUDEP, or sudden unexpected death in epilepsy. Clive had been living in residential placements for years up until this point, moving often. Before he died, Clive's family had become really worried about his deteriorating health, and tragically, so had Clive. He left a message on his dad's phone, which was not received until some days after his death, saying that he was dying and that he needed an ambulance. Clive was not listened to, his family were not listened to, and the consequences were devastating. Clive's family, after that terrible event, had to fight hard for answers. First, to secure an inquest into his death, and later to secure an independent review. When that review was completed in 2021, 4 years after Clive died, it confirmed what they had suspected all along. The independent review found that Clive's care fell far short of what should be expected of somebody with drug-resistant epilepsy. It identified multiple system-wide failures in delivering his care and treatment that put him at greater risk. It found that his death was potentially avoidable and that he had been failed both in life and in death. But what does that mean in practice? It meant that management of Clive's epilepsy was fragmented. The link between his epilepsy and the sometimes challenging behaviours that he could exhibit when stressed, like not taking his medication or withdrawing to his room or not communicating, were often overstated. These behaviours disproportionately impacted on the generally held view that Clive required a hospital setting. Despite the fact that he'd long expressed a wish to live in his own home, care in the community was only discussed with him and his family towards the end of his life. And that kind of draws to where we were with where Clive's life was. I think if we move on to past Clive's death, I think it's really important to pay tribute to Clive's family. Throughout all of the suffering, they've been relentless in their focus on ensuring that other families do not go through what they had to. And that's why we're here today. And for me, it's what this debate is entirely about. I, of course, will give that.
Madam Deputy Speaker, first thing, can I congratulate and thank the Honourable Gentleman for Lichfield for bringing this forward. His choice of words, his tone, his compassion and his voice, I think it's a real tribute to Clive Treacey and to his family here in the gallery today. And I think the honourable gentleman has done a wonderful tribute for him. And I want to put that on record as well. And I think it's right to do that. Incidentally, I'm an Elvis Presley fan as well as he was. Although he could probably sing better than I could, but that's just by the way. Does the honourable member not agree that whilst nothing can bring back the life of this young man, his legacy can be life-changing for so many others? And rather than best practice, this must be rolled out as a recommended tool throughout each trust in each area of this United Kingdom of Great Britain and Northern Ireland as a tribute to Clive Treacey.
Dave Robertson.
I thank the honourable member for his intervention. It's actually my first intervention from the honourable member for Strangford. He does raise what's a really important point, though, and actually, when he's asking that question, I thought back to a couple of weeks ago. I was asked at a community event, what gives you hope, Dave? And I thought for a while, and actually, so often we come to this place and we hear stories of people who've gone through unimaginable hardship, and somehow they find the strength within themselves to turn that not just into anger, and they don't turn it inwards, but they can turn it outwards and really campaign to make sure that this doesn't happen for other people. And that's exactly an example of what we've got here. And I think it is the very best testament to actually the human spirit that we see so many examples of human beings who are able to do that. So I very much thank the honourable member for his intervention. If we return, though, to Clive, Clive, like a quarter of people with a learning disability, had epilepsy. It's 1 in 4 people with learning disabilities have epilepsy, compared to 1 in 100 of the general population. Coupled with that is that epilepsy is the second most frequently reported preventable cause of death for people with a learning disability. And not only are people with a learning disability more likely to have epilepsy, the risks they face from their epilepsy are higher too. SUDEP risk, which is what killed Clive, is more than 3 times higher for those with epilepsy and a learning disability compared to those with epilepsy and no learning disability. And tragically, Clive's case is not an isolated example of the unique failures. It's a story that goes far too common across the country. But there are things that we can do to change that story. Research suggests that annual health checks can significantly reduce the chance of premature death in people with learning disability and autism who have epilepsy. In fact, the chances of death were reduced by 84% for people with a learning disability and epilepsy who'd had a review of their epilepsy in the last 12 months. And that really brings me on to the Clive Treacey Safety Checklist. The checklist is a tool developed after Clive's death and an important part of his legacy. And I'd like to place on record my thanks to Professor Mike Kerr and Professor Rohit Shankar for their work on the checklist, alongside with the charity SUDEP Action, NHSE Midlands, NHS Cornwall Partnership. The checklist was designed for commissioners and service providers, whether they're caring in a specialist hospital setting or out in the community, and it outlines steps that should be gone through annually, as well as whenever a patient moves between services or has a big change in their care, like a new team looking after them. It recommends up-to-date health plans, genuine consultation with parents and their families, not box ticking, but genuine consultation, and proper epilepsy training for staff. The Clive Treacey Safety Checklist is not a document that should be put in a drawer somewhere in an ICB and left alone and looked at once every so often when someone asks a question about it. It's a practical tool, and the accompanying guidance at just 24 pages long, which I think we all know for the NHS is a short story at best, it is packed with information, and it is a document that can save lives. Since Clive's death, a number of NHS regions have reviewed the way they care for patients with learning disabilities and epilepsy using the checklist. And it includes the NHS in the Midlands, where 11 integrated care systems carried out a detailed appraisal using the self-assessment tool developed by the charity Epilepsy Action, based on the work of Professor Shankar, to find those weaknesses in their services and make concrete steps to improve them. More recently, 6 integrated care boards in the North West, North East and North Yorkshire have done the same. And it really is detailed work, bringing health and care services together in joined-up thinking, something we don't hear enough of in Whitehall, to tackle this problem and normalise best practice. That best practice, like the Clive Treacey Safety Checklist, should be more widespread. And I again pay tribute to Elaine and Clive's family more broadly for the work that they've done driving this entire piece of work forward. The problem is that we still have a postcode lottery. Different parts of the country do and don't follow the checklist. Different parts of the country have and haven't gone through that detailed work to update their practices. And we should not be able to, we cannot in this House tolerate a situation where local outcomes are so varied. So I'm really hoping that we get to hear from the Minister shortly is what more we can do here in this place and through the Department of Health and Social Care to ensure that people with learning disabilities are not dying of preventable causes, and to see the very best practice as set out in the Clive Treacey Safety Checklist adopted up and down the country so that we can end this perverse postcode lottery. Thank you, Madam Deputy Speaker.
I call the Minister, Dr. Zubair Ahmed.
Thank you, Madam Deputy Speaker. I'd like to thank my honourable friend, the Member for Lichfield, for securing this important debate, and also to recognise the efforts of Clive's family, particularly Elaine and Michael, who join us today in this House. As my honourable friend described in his wonderful speech, Clive Treacey was a caring, gentle and humorous man who liked to paint and enjoyed gardening and listening to music. Clive also, as we have heard, had a learning disability and epilepsy, and sadly died in 2017 at the age of just 47 following a seizure. His loss, I'm sure, is still very deeply felt by his family and loved ones, and I pay tribute to all of the work they have done, the tragedy they have channelled, and continue to do so in advocating for change following Clive's death. The independent review into Clive's death highlighted that there were multiple system-wide failures in delivering his care and treatment, and together placed him at higher risk of sudden death. It was found that Clive experienced suboptimal care and support throughout his life and death, and that he was not always placed in settings that could meet his needs, both in terms of his epilepsy care and wider support for his disability. I am pleased that since Clive's death, meaningful changes have been made. Following the publication of the independent review into his death in December 2021, organisations directly involved in Clive's care developed high-level actions in response to its findings, and there was an overwhelming commitment from all organisations involved to address the systematic issues raised in that report. NHS England Midlands region set up a group that became known as the Clive Treacey Conscience Group, and last year published Clive's Way, a conscience manual which outlines in detail the progress Midlands region is making in taking forward and implementing the learnings from the independent review. We know, Madam Deputy Speaker, that around 30% of people with epilepsy indeed have a learning difficulty, and the risk of sudden unexpected death in epilepsy is much higher with those with a learning disability, as my honourable friend pointed out. The latest annual Leader report, that's Learning from Lives and Deaths report, found that epilepsy was one of the most common underlying causes of death for people with a learning disability between 2021 and 2023. This highlights how crucial it is that information and support for patients with epilepsy who have a learning disability is tailored to their individual needs. We welcome the development of the Clive Treacey Safety Checklist. It is an important part of Clive's legacy, and we would encourage commissioners and service providers to use the checklist and its accompanying guidance as a key tool when designing services for their local populations, and to make sure that the steps outlined in the checklist are followed whenever a patient experiences a significant change in their care. Since Clive's death, a number of NHS regions have reviewed the way they care for patients living with learning disability and epilepsy.
Next move that this House do now adjourn.
The question is that this House do now adjourn. Clive Treacey Safety Checklist. Minister, Dr. Zubair Ahmed.
Thank you, Madam Deputy Speaker. It is also a very positive development that a number of integrated health boards in the Midlands, North West and North East and Yorkshire have carried out detailed appraisals to identify any weaknesses in their services. My honourable friend, the member for Lichfield, raises an important point about how we go further, including how annual health checks can significantly reduce the chance of premature death in people with a learning disability who have epilepsy. NHS England has developed a quality framework to set expectations for annual health checks for people with a learning disability and accompanying health action plans, which are vital to identifying needs early and providing the right support and mitigating risks of sudden death. NICE guidance on epilepsy in children, young people and adults recommends that people with a learning disability should have monitoring reviews at least annually The NICE guidance on epilepsies also includes a number of recommendations how information should be tailored and adapted for patients with epilepsy who have a learning disability. It sets out that patients with a learning disability should have access to specialist care and should receive coordinated care using a multidisciplinary approach. For young people with a learning disability who are transitioning to adult epilepsy services, transition planning should begin early. This government expects commissioners and service providers to take NICE guidelines fully into account when making decisions about how to meet the best meet the needs of their local communities. We are also rolling out mandatory training on learning disability and autism to health and adult social care staff. Support for people with a learning disability is also a key area of focus for the NHS Right Care Epilepsy Toolkit. This toolkit includes a number of actions that systems should be taking to support people with epilepsy who have a learning disability, such as ensuring that specialist epilepsy services are upskilled and are making reasonable adjustments to support the needs of people with a learning disability, including working in partnership with staff trained in how to manage learning disability. The toolkit also sets out that services should ensure that community specialist nurses in learning disabilities have the right training in the management of epilepsy. I would also like to recognise, Madam Deputy Speaker, the important work of organisations like Epilepsy Action and SUDEP Action. Epilepsy Action has produced the Step Together toolkit, which describes what good quality integrated services for people with a learning disability and epilepsy should look like. SUDEP Action has developed an epilepsy self-monitoring app, which is a digital tool designed to help patients understand their own personal risk of seizures and to track this risk. SUDEP Action has played a key role in the development of the Clive Treacey Safety Checklist. Madam Deputy Speaker, I would once again like to thank my honourable friend, the member for Lichfield, for securing this important debate, and to also thank the honourable member for Strangford for his contribution. It goes without saying that Clive's death must not be in vain, that we must learn the lessons to ensure it does not happen again. But I believe, Madam Deputy Speaker, we also need to commit further, that no longer in our National Health Service should tragedy be the only way to make things better for the patients and citizens we serve and to save their lives. That finally, the patient voice must be our guiding star when designing services and safety checklists and keeping patients safe in the community and in hospital. And I believe to the actions we have taken in our 10-year health plan, and I, in my position as Patient Safety Minister, can undertake today to members of this House that shall be the case going forward in this government's approach to patient safety. Thank you.